Imagine being able to have a pretty good idea that a drug you're about to take is going to be good or bad for you, and all based on a simple genetics test that tells you which pharmaceutical medications are right for you. Well, we're talking about that today on episode number 3 of Overprescribed. Welcome to Overprescribed, the show that raises America's awareness on pharmaceutical medications in this country, all in an effort to help you, the everyday consumer, to live the safest, healthiest, and most informed medication experience possible. I'm your host, Mika Pollock, and on today's show, I want to talk with you about something called pharmacogenomics and pharmacogenetics. Now, we will be touching on this again in future episodes, but I wanted to touch on it early on in our podcast launch because I think it's really important and I really want to put it on your radar, especially if you're someone who's taking more than one medication every day or every week. So a couple of years ago, while I was doing some of my own independent research about pharmaceutical drug issues that weren't so talked about in America, I stumbled across the science of pharmacogenetics and pharmacogenomics, and it really blew my mind and it really piqued my interest. In general, it really captures the breadth of what precision medicine or personalized medicine is really all about. So having a tailored drug therapy that is unique to you. And this science is changing lives every day. I think it has the potential to completely change the game on a larger nationwide scale for how we make decisions to take or to not take medications. And because it is not common across the U.S. or the practice of pharmacogenetics testing is not common, I don't think many people know much about it and how it could help you or your family today, right now. Historically, the relationship of drugs to individual difference in drug response dates back decades. I'm talking, look back to the 1950s, 60s. But the term pharmacogenomics wasn't really coined until probably the 90s. Last year, I found this really cool site called PharmGKB, which stands for Pharmacogenomics Knowledge Base. And I'll include a link to their website in our show notes. Now, according to PharmGKB, they're a resource that collects, curates, and disseminates knowledge about clinical actionable gene-to-drug associations and genotype to phenotype relationships. And they're funded by the National Institutes of Health, or the NIH, which is an agency under the Department of Health and Human Services. While pharmacogenetics and pharmacogenomics are not the same thing, both of these really long words are used interchangeably quite often. However, PharmGKB had a really nice definition of the difference between the two, and I want to share it with you. According to PharmGKB, pharmacogenetics refers to how variation in one single gene influences the response to a single drug, whereas pharmacogenomics is a broader term which studies how all of the genes, or the genome, can influence responses to drugs. Now, to keep it simple, I'll probably refer more often to just a single term, and I'll choose pharmacogenetics. So this pharmacogenetics is really fascinating science. And if it's implemented nationwide, meaning it becomes mandatory and standard of care for everyone, it has the potential to have groundbreaking effect in America. Think about it this way. Not every drug will have the same effect in every person. And that's the heart of the science and the test that comes with it. And the test helps to determine a person's unique drug response profile to a variety of different drugs. Because scientists know and have known for some time that there could be individual differences in drug response. And the test has strong potential to give a person, for the first time ever, an opportunity to know if a drug may be good or bad for them. So, for example, the test can tell how well you'll metabolize a certain drug, because some drugs are inactive in your body until they're metabolized, and while other drugs are active in your body until they are metabolized and then become inactive. So, the pharmacogenetics tests can help determine if a person is going to be a good responder or a non-responder. And much of that centers on how a person's body metabolizes a drug. After you take the test, which is commonly a simple cheek swab sample that's then shipped off to a lab with results shared with you and your doctor after results are in, a person can then be revealed as an ultra-rapid metabolizer, someone who's an extensive or normal metabolizer, or even someone who's intermediate or a poor metabolizer for a certain drug. And this can tell someone how well your body processes or metabolizes the drug and impacts your body's reaction, with the classification of ultra-rapid metabolizer and poor metabolizers being on opposite sides of the spectrum. Variations in your genome can help with identifying the right dose of medicine, which ones will be ineffective for you, and even which ones may put you at higher risk for adverse drug reactions. And this is why you may have met people who had this exact same medicine at the same dose, but had very different responses or feelings while on the drug. For example, like a particular pain medicine like codeine. I even read an article, and I'll put this on our website at overprescribedpodcast.com, that said that people with red hair are more likely to need more anesthesia than others in order to feel the proper numbing effect due to their genetic makeup that results in red hair. And I thought that was interesting. Pharmacogenetics has even revealed there could be different drug responses in certain racial and ethnic groups. According to one 2015 research study, approximately 20% of new drugs approved in the last few years up to that publication had known racial and ethnic differences in disposition. So pharmacogenetics testing has the ability to predict that a drug can be more targeted to the individual based on the individual, which then results in a safer, more effective drug experience. But here's the big question. Why is it not standard of care and more known and talked about? Well, this is where it becomes controversial. For one, it's not mandated by law. It's largely an optional test. Now, you may find that certain drugs, like those that are for treating cancer, will have an advisory in the drug label recommending strongly and expecting that a pharmacogenetics test will be done before that drug's prescribed to a patient. But this is not the case, nor is it blanket practice for all drugs that treat type 2 diabetes, for example, which is a chronic condition that impacts millions in the U.S. every single year. Meanwhile, people in healthcare are not necessarily rushing unanimously to implement. Like any new process, it takes training, education, oversight, and even enforcement. Drug manufacturers aren't unanimously rushing either. Pharma companies around the world would possibly risk losing tons of money if it was mandated for all, because certain people who are on the drug now, which could account for in the millions depending on the drug, will be eliminated as consumers of the drug, either by their healthcare provider's decision to not prescribe based on the pharmacogenetics test, or because the patient themselves said no thanks based on the results of their test results alone. Pharmaceutical companies would also need to change how they do every single clinical trial, accepting tough realities about the drugs they can and can't move forward with, if it was to become mandatory even in the investigational drug phase, which would completely change the financial projections for their businesses. Physician offices would need to change their practices if it was standard, and some physicians may find it cumbersome or difficult to interpret test results. As a matter of fact, this has actually already been expressed and noted in different articles. Physician offices may even be reluctant to embrace that now they need to make prescribing decisions based first and foremost on a test and no longer largely on their own medical expertise or accepted standard of care in the medical world. Now, physicians may already do that. There's always diagnostic tests out there to help lean forward with a clinical diagnosis or recommendation of treatment. But here you're adding another test to that. So this could all get really dicey. There's also implications for healthcare from providers, insurance companies, and even consumers. So who's going to pay for this test that can easily run anywhere from $300 to $600? Right now, the test could be too expensive for a patient to pay for out of pocket if their insurance won't cover all or partial. And if the expense is going to be a barrier, then it creates an environment of ethical questioning where household income and affordability determines who receives the test or not. And then it makes you say, well, just because one person has more money than another person, does that mean they deserve the test more? Of course not. Another barrier to implementation involves the labs in the U.S. that offer the tests. Not every lab offers the exact same test panel. Some labs only test for a person's response on 100 drugs, while others test on close to 300. So there's variability there. Also, some labs aren't what people consider to be the greatest labs and may not be certified as meeting certain quality standards. And how do consumers and healthcare providers navigate those waters and make decisions about which labs to choose? And one of the biggest barriers to pharmacogenetics testing being mainstream and mandatory for all appears to be in where the science lies today and the limitations that exist today. So while there are over 1,000 prescription medications on the market today, the science hasn't advanced enough yet to determine how every single drug on the market will react in every individual. So it's still considered an emerging science, which tends to put an emerging science on the sidelines as people wait for the end game. But are these barriers fair? Should we approve a drug to be marketed and sold in the U.S. without knowing for sure who would benefit versus not benefit based on their genetics? People are concerned about drug prices, the opioid crisis, increasing access to pharmaceutical medications. But what about making sure the drugs that are on the market accessible and being prescribed are safe in the first place for an individual? It's not a mandatory test right now, but I have read articles that mention how some physician practices and even pharmacies are embracing and implementing pharmacogenetics testing into their practice, especially for certain individuals. So are you ready to know your pharmacogenetics results, like you know your address or your phone number, things we know with our eyes closed? Are you ready to embrace this particular type of science to allow yourself to know more about how your body may or may not respond to different drugs? In many ways, patients or everyday consumers taking the step on their own to ensure they are pharmacogenetics tested is a step in the direction of consumers really taking control of their healthcare in the U.S. And I think that's a good thing. As a consumer, I want you to be more involved in your healthcare decisions and to be as proactive about it as possible. And a pharmacogenetics testing is doing just that. It's being proactive. Maybe you've been taking a drug for years and it really isn't the right drug for you. You're not sure if it's working. And maybe you're spending money on something that has no benefit to you. Pharmacogenetics has the potential to uncover that. So are you ready for that test? Have you ever taken one of those tests before? And have the results changed how you and your healthcare team have exposed you to certain medications? I want to hear about those stories, so tell me about them. I'd love to hear from you. You can email us at talk@overprescribedpodcast.com. Again, that's talk@overprescribedpodcast.com. And also, before you go, please take a moment and subscribe to the show if you haven't done so already. We also want to hear from people in regards to how they're enjoying the show, so leave us a review. And lastly, you can always find us on Twitter at _overprescribed. Again, that's at _overprescribed. Thanks for listening.